Our nation is now on a path to reopening local economies in the communities where we live and work. As states navigate their new normal in the days and months ahead, we know that our nation's NPs will rise to meet this new healthcare challenge. But we also recognize the severe, unintended consequences these vital and necessary shutdowns have had on our patients, and as well as our practices. Patients with chronic conditions are in desperate need of access to care that extends beyond the phone lines and telehealth visits. Families need routine screenings, vaccinations, and well visits. And, as we all know, patients with suspected cases of COVID-19 will require testing and care that extends far beyond the hospital walls into local communities and primary care clinics. For primary and specialty care NPs, COVID-19 has upended the routine care our patients depend on, and with it, the stability of NP practice. We have heard from NPs who have experienced layoffs and furloughs while patients follow stay-at-home orders. We have read your reports of reimbursement challenges, providing phone-based care and sometimes telehealth care, and we have advocated with state and federal policymakers on your behalf. At AANP, we have worked directly with the administration to advocate adequate access to PPE as well as increased testing, which is so vital to safely reopening our communities and providing sustained patient access to primary care around the nation. By communicating with us about the challenges that you are facing during this crisis, you're helping shape the conversations that we are having with lawmakers in Washington, as well as around the country in the states. This will be especially important as leaders decide how our country moves into the next phase of opening states safely. As the plans are being developed, the American Association of Nurse Practitioners will continue to call on lawmakers to support our patients and our profession. And we're going to do this by doing several things. Advocating for increasing PPE supplies, for example. Nationwide, we've heard from our membership that there are still critical shortages of PPE across all settings. Adequate PPE supplies will be key to keeping healthcare providers safe as they screen patients and provide high-quality care to patients. And this is essential to reopening clinical practices that have closed because of lack of personal protective equipment. Raising our testing capacity. The American Association of Nurse Practitioners is continuing to call for a ramp-up of our nation's testing capacity. This will enable us to better identify those patients who have COVID-19 and will help protect our patients, their families, and our healthcare workforce, which is so important right now. And we're also working on addressing the economic burden COVID-19 has had on NPs and other providers working in primary care, urgent care, and specialty care settings, and those serving Medicare and Medicaid patients. While healthcare providers have done an excellent job providing care to patients, social distancing and fear over COVID-19 have had a tremendous economic impact in terms of lost jobs, furloughs, and financial losses. This must be addressed to ensure our healthcare system remains strong and accessible for our patients. In the interim, if your job has been affected by the COVID-19 crisis, please visit the AANP Job Center for resources. In the weeks to come, as states reopen, we may see more COVID-19 patients presenting in our practices. Ensuring we are equipped with PPE and testing will continue to be a top priority for us. Your health and safety are essential to your communities and the patients you serve. Please continue sending us your feedback so that we can deliver your message to lawmakers. Thank you for your hard work and protecting patients, and we know that your professional association is fighting for you as you work to maintain your practices and access to primary, specialty, and acute care in our communities. This is a critical phase for our nation as we navigate this pandemic. Thank you for all you do. God bless, and please stay safe.